Good day, everyone. I'm here to talk to you about an important challenge faced by administrators in the healthcare industry today. That is ethical compliance, accountability, and humanity. Now, how does the healthcare administrator balance these? Basically, it's a question of professional ethics. And what are professional ethics? The modern view of ethics is choosing right over wrong whenever a moral dilemma presents itself. And we must all remember the general public views healthcare providers as representing the very epitome of ethical behavior at all times. Let's consider the challenges to healthcare administrators. Society sets formal laws and regulations telling them exactly how they expect them to act ethically in almost any given situation. But this begs the question, are they able to make their own ethical choices? Well, the answer is definitely. Now look, laws, rules, and regulations, they only set the parameters we as directors act within. It is the individual administrator who decides how ethically they respond within those mandated guidelines. Confusing, right? We as healthcare professionals, we ensure compliance and accountability to everybody, but in the most humane way within our given boundaries. Let's examine the three primary issues that most affect ethical outcomes, shall we? And these areas of concern are information technology, healthcare law, and human resources, legislations, laws, and responsibilities. First, information technology. We all know it affects everything we do nowadays. We now have internal and external departmental communication. We send, receive, and record patient information almost instantaneously. We've got national electronic medical databases, and let's not overlook electronic medical coding and billing. IT has literally changed the whole face of the healthcare delivery system. Really, folks, think about it though. How can something so positive possibly create an ethical dilemma? Think of real-world examples that might make that clear. Imagine what could go wrong in any one of those situations in which human error meets information technology. This creates serious ethical problems. Information technology is only as accurate as the policies and procedures that guide it. It doesn't know right from wrong. Immediately, most of us in the healthcare industry think of HIPAA. Now, HIPAA is great, but the actual procedures and guidelines to staffs fall to the healthcare administrator to ensure compliance and accountability. Whether the upper or lower boundaries are applied case by case or as a general rule of thumb are decisions that they make according to their own feelings weighed against economic, social, and legal commitments. And that brings us to the second dimension, healthcare law. Realize this, legislated healthcare law does not keep pace with the speed of modern medical advances. The fear of litigation these days causes a created aura of defensive medicine industry-wide. Now administrators have to consider possible punishment from such things as malpractice and negligence over any ethical choice they make. These concerns are compelling administrators to comply only with baseline legislated ethics without truly reflecting themselves. After all, legally set ethical boundaries is what society demands of its healthcare industry. Administrators, professional associations, universities, politicians all across the nation try and exert pressure upon the legal system to officially set and enforce these ideas of upper and lower moral boundaries. But it is up to the administrator to keep abreast of all these laws, changes, and trends to be able to adhere to the requirements of modern healthcare law and all the possible social and legal ramifications. But they still have to be cost efficient and humane. And finally, human resources. A good ethics-based administrator knows and respects their people and support their efforts to get that respect returned. Just like in modern healthcare law, human resource law provides only basic minimum protections for the workforce. These, again, are just basics. And how beneficent, fair, and just an administrator interacts with their staff is what reflects the moral philosophy the administrator themselves truly embrace. Now let's summarize. Administrators are the ones challenged to protect the economic, social, moral, and legal interests of their stakeholders, patients, and public, without falling below minimum standards of fair dealing or social justice. The very career profile is expected to encompass the very, very best qualities of managers in the world of business today. Their choices must equate to more than strict adherence to minimum standards. It is through administrators' actions and influences on committees, boards, and personal relationships that they provide the best possible outcome for everyone in the patient-provider relationship. The ethics-based administrator's success is measured in fewer malpractice claims, positive feedback from those that they serve, and the perception of a just corporate climate and positive regulatory evaluations. Thank you very much.